dread nothing but the loss of you, and to cast all our care on the one who cares for us. Preserve us from faithless fears and worldly anxieties, and grant that no clouds of this mortal life may hide from us the light of that love which is immortal, and which you have manifested unto us in your Son, Jesus Christ our Lord. Amen. For Bob Brasher, that's prayer number 80 on page 670. Good morning. There are handouts right there. Okay, we're going to start. Are you coming to the class, Caleb? Today is the second part of the class. The last class, I was so kindly told just a moment ago, really was an important thing. So I'm glad you came today. This is a little bit more important. But today we're going to talk about being prepared, running the laps. You know, you have to be prepared. If you're a runner and it's you have to run 10 laps, you don't put everything into the first lap. If you do, you won't make it to the 10th. And so the whole idea is, how can we prepare you? And how do we need to communicate? But more importantly, how do we look at these things in light of our expectations? We were on vacation last week, and our daughter said something very strange. She said, and she's never said anything like this before. She said to Nancy and I, well, I hope, we were having a conversation about siblings. And she said, well, I hope you have all of this put to bed, because I don't want to put up with the other two. You laugh. But if your children are honest, they would tell you the same thing. And so the greatest gift you can give to your children is preparation. And I talked about that a little bit the last time we met, although that wasn't very important. So,
you're not going to get past that, are you?
Yes, I am. When I make the next slide, I'm past it. Okay, so let's watch just a brief video. And Hezekiah. Wrong way. That's okay, and I messed everything up. Well, let me get this. Can you turn that up, please? Nothing like technical difficulties. Good morning. Oh, that's one of the reasons it may not have worked. It was not hooked up, huh?
Well, that was a sound issue. I know nothing whatsoever about this.
Fight every battle, everywhere, always, in your mind. Everyone is your enemy. Everyone is your friend. Every possible series of events is happening all at once. Live that way, and nothing will surprise you. Everything that happens will be something that you've seen before.
Okay, if you'll go to the next slide. The interesting thing about when we're in crisis, many things begin to happen in a pace that's much faster than they would normally happen. Things that would be mundane information, suddenly you don't have access to it. And so the real key to handling things in crisis and how to handle illnesses and those kind of things is to be prepared. How many of you take more than one daily medication? How many supplement with that with homeopathic medication? Vitamins? You might as well just leave your hand up. I'm going to ask other questions. So You need to have a list on your person that says, I take these medications daily in this dosage, and list of medication. Why? Well, if you go to the hospital, one of the first things that they have to be aware of is what medications you're on so that they don't give you something that counteracts what you're taking, or you have an adverse reaction. So the first thing to do is have a list of all current medications, drug, dosage, and frequency. You can put it in your phone, you can put it in your wallet, whatever you need to do. I carry it in my wallet. But I would put it somewhere on my person that if I was incapacitated, someone could find it relatively easily. Also have a list of contacts. You can do that on your phone. Why do you have contacts? First of all, if you're being diagnosed, you want to have somebody that can hear the diagnosis. If you are in a state of, I won't say panic, but certainly high anxiety, you're not going to necessarily hear anything. I try to make it a point, if someone is going for a significant diagnosis, I try to be with them if I can. If for no other reason, I'll give you an example. We had a parishioner who was given a fatal diagnosis. And the doctor's going through the diagnosis and what's the next steps were, and our parishioner kept looking at me like, what is he saying? And so I finally said to the doctor, I said, would you stop just for a second? Pretend that this man is your father and tell him how you would tell your dad. And that's exactly what the doctor did. But if someone hadn't have been there to watch the reaction of the patient and watch the reaction and the explanation by the doctor, it would have gone right over their head. And so it's always important you have somebody with them. Have a current advanced directives with you if you're going. That's if you're going to the hospital. Have them readily available. If you're taken to the hospital on an emergency basis, they're going to ask you, do you have an advanced directive? And the advanced directives are quite complicated. It used to be, do you want to be resuscitated, yes or no? Not anymore. It's quite a long form. I'll be glad to meet with you personally to fill them out. We'll keep a copy of it here, and you can keep a copy of it at home. Any forms that you fill out, we digitally put into the file, and we keep it under lock and key. Nobody has an opportunity to get to it. But you need to have an advanced directive. Give you an example, a perfect example. I had a parishioner a few years ago, had a massive cerebral hemorrhage. He was 54 years old. And it was obvious that there was no coming back from this. His family didn't know where the advanced directive was. We had one at the church, and they were able to end life support, thus not continuing a life in a manner that would have been detrimental to everybody involved. So it's very important you have advanced directives done. Absolutely, absolutely. And the other thing is, make certain that anybody that is consequential in the care of your life has a copy of your advanced directives. That means your primary care physician needs to have a copy of your advanced directives. If nothing else, the doctor can call your primary care physician. We're going to talk about the relationship between your primary care physician and hospitalist, because it's a very unique one. Assertively ask questions. Men are particularly bad about this. And I don't mean to be derogatory about men, is because we're 10 feet tall, we're bulletproof, and if we can just pull ourselves up by our bootstraps, we'll be okay. That's just the way we're made. It's the way we've been culturally taught. And so women usually are much more detailed in the questions that they ask. And so this is really important. If you have any doubt in your mind, and I'm going to get to the last point in a minute because it's germane to everything I'm saying. If you have any doubt at all, ask. Ask them to reiterate it again. Be assertive about it. You have that right. And by the way, set pride aside. About 1 out of every 3 people go to the hospital or go to a doctor's appointment, and they see that appointment as somehow they're being judged as a human being. Up until that point in time, they had convinced themselves that they weren't flawed, that they weren't human, that they weren't going to get sick. And that's a huge barrier to becoming well. And so put your pride aside. The doctors and nurses are there for one reason only, and that is to bring health into your life. And so if you're going in and you can handle this, or you think you can handle this, you're sadly mistaken. And so put your pride aside, particularly guys. And by the way, I'm a guy, I'm probably as guilty about it as ever. I have to tell you a very quick story. I had major surgery on my leg in '87. The doctor was a very smart doctor, and he was the physician for the Red Sox and the Bruins and the Celtics. And so he dealt with a lot of egomaniacs, and he just had another one. And so I had a block. And he said, the block's going to wear off about 1 o'clock in the morning. He said, how about if I leave you a prescription for pain medication? I said, Doc, I got this. He said, no, I'm telling you, this is going to hurt. He said, you're going to wake up and the block's going to go off, and you're going to think your leg is falling off. I got this. I am 39 years old. I am in great condition. Bring it on. Well, 1 o'clock in the morning, I woke up and I thought my leg was falling off. So I hit the button, and the nurse came in, and she had the most strange smile on her face. And so she said, let me guess, the block has worn off. And I said, yes. I said, I'm ready for the pain medication that the doctor left for me. And she said, well, you said you didn't want any. So what he did is he said, I could give you Tylenol 3 with codeine as often as you needed it. That doesn't work. And so the next morning when he was doing his rounds, he stuck his head just inside the door, and he said, how you doing, champion? When they ask you your pain level, be honest. Because it's easier to get ahead of the pain level than it is to catch up. So be honest about it. Set pride aside and assume the responsibility for following the treatment plan. I wish I had a nickel for every time I've been with someone and that they've said, well, the doctor gave me this medication to take, but it makes me feel funny, so I'm not going to take it. Duh. Either take it or call the physician and tell them how it makes you feel and get another prescription. But you need to follow the treatment plan. The last time I checked, most of us do not have MD after our name. Know the patient's rights. There is an entire list of patient's rights, and I'm going to go over with you in just a minute. Communication is the key. You need to communicate. Listen closely and speak clearly. And if there's something that you didn't pick up, ask them to repeat it. Do not let the physician leave your presence until you feel comfortable with all the information that you need to have and that the physician needs to have. There's a couple of you that have been in the trauma room. I was a hospital chaplain for a while and did a lot of work in the trauma room. It's amazing what happens, folks. The whole purpose is to save the life. And often what you don't know can be just as problematic as what you know. And so communication is key. And the other thing I want to impress upon you, do not self-medicate or self-diagnose by using Google. You laugh. I hope it's nervous laughter because I bet you 60% of you are guilty of it. This past week, I was talking to someone who said, well, I'm going to get a particular shot. Well, why? Well, I was looking on the web and said somebody my age should have that shot. And I said, well, did you discuss it with your physician? Well, no, but I am of that age. Well, let's see, you have cardiac issues, you have lymphatic issues, you have thyroid issues. You might want to check and see if that is going to have some detrimental effect. And so the other thing is, folks, Piedmont is absolutely fantastic. So is Grady, so is Emory, with their note system. But they are notes, they are written, the doctors write them for the doctor's purposes. They are not written for your edification. And so you're reading these notes, and all of a sudden, everything that you think could go wrong in your mind is going wrong because one word may have 10 different meanings, but you don't know the circumstances by which the doctor made that note. Having spent time making notes in the system, I know that making notes in the system is left behind for the medical staff, for them to make assessments based on what they see in those notes. And so it's really important that you not read those notes and go off the deep end. I've known people to read the notes and stop medication. Folks, if you have a question about anything you see on the notes, pick up the phone and call the doctor's office. Do not make the assessment on your own. How many of you went to medical school? I didn't think so. Okay. Next slide, please. As a patient, you have a right to timely care. Now, there's a great deal of frustration around the ER, particularly in this area. You need to know that the ER at this area is severely impacted by the loss of 2 hospitals. We lost 2 hospitals. They closed last year, and all of the ER traffic is being transferred to either Grady or Piedmont Fayetteville. Okay. So I will tell you, if you feel that you need to go to the ER, call either Noonan or Fayetteville and find out what the wait time is and go to the one with the least amount of wait time. They both will accept you. But just understand that the ER is full of sick people and they're all wanting the same thing you are, treatment. And the job of the nurses and the staff is to triage based on severity of injury or illness. That's why people who have heart pain, chest pains, get priority. So be treated. You have the right to be treated with dignity and respect. If you are not, I urge you to not put up with it. Yes, sir.
I would suggest if you have a cardiac issue, you find out who's the cardiac hospital because you might go to one hospital and they don't have it.
Oh, brother, sometimes you don't have the time to do that.
I know.
That's why they have Lifeline.
You have to do it before.
Okay. Medical care, you absolutely have the right to medical care that is free from discrimination on the basis of age, sex, race, ethnicity, national origin, language, disease, disability, or religion. Please keep that in mind when you are in the ER and you look at all the people who are in the ER. They have the same right to medical care you do. And so give them some grace. You have the right to easy to understand information about your diagnosis. That's why I said, be certain to say, tell me what this means. Ask your medical provider questions so that you can be informed about the decisions on your health. Give an example. We often say, okay, here's the diagnosis. You need to ask the what if questions. What if I don't do this? What if I do this instead? What if I wait for a while? You have the right, and you're going to hear it in just a moment, you have the right to defer treatment, but you need to do it based on good knowledge. Communicate. You have the right to communicate confidentially with your medical service provider, knowing it's not going to be shared with anyone. I did my work in the hospital before HIPAA took effect. As a chaplain, I could walk to the to the central desk, I could pick up the chart, and I could read everything that was going on with the patient. So that when I walked in and had a conversation with the patient, I could do so in an informed manner. I couldn't do that today. HIPAA precludes anyone getting information but the medical staff. So privacy and confidentiality as outlined in the Notice of Privacy Practices, and that's available in all health units. You have the right to withdraw your consent, delay, or otherwise refuse examination, intervention, or treatment. Two things. Don't do it unadvisedly, and don't do it without the knowledge of the consequences. Yes, sir. Did you have a question, Vince? Next slide there, I'm sorry. I don't have a clicker. So.
What's the difference between having a clicker that doesn't work and not having a clicker?
You have a placebo. It makes you feel good that you have one. I have the clicker. You have the right to continuity of care. This is one of the greatest complaints that I hear with people in the hospital. And you need to understand how hospitals work, and we're going to talk about that in a little bit when we talk about communication. But with the advent of Obamacare and the advent of several other practices in the medical world, most personal physicians do not have rights to go into a hospital. It's all handled by hospitalists. And so you have the right to have continuity of care. You have the right to have the same care by the person who sees you every day. And believe me, sometimes that can be a problem. And so you have to say, if it's something that's different than what you have heard before, you just ask a simple question. Did you read the notes? Is this consistent with previous treatment? So you have to kind of be your own advocate. Am I wrong, Wendy? So you have to be your own advocate. You have the right to review and request amendments to your medical records. The medical records are yours. You have every right to see them. You have every right to take them. You have every right to discuss them. They may be housed in a medical facility that looks wonderful in an ivory tower, but they are your records, and you have the right to them. You have the right to provide confidential feedback about the matter to hospital staff or other organizations that can do something about it. And so you need to know your rights. You're there to be treated. The hospital has the obligation to treat you in this manner, okay? But you also have responsibilities. Click, click, thank you. You also have responsibilities. You are to conduct yourself, your interactions, with other patients and visitors in a respectful and polite manner. I find in the hospital that a teaspoon of sugar will get you a lot more than a gallon of vinegar. Those are hardworking people. Let me put it in perspective for you. What other group of people do you know that go to work every morning and have the lives of the people that they see in their hands? It's a pretty onerous responsibility. So keep that in mind. They are human, they're doing their best. So conduct your manner in that verbal or physical intimidations, violence, or the threat of violence is and will not usually be tolerated in a hospital setting. Be honest and forthcoming. That's just downright common sense. If you're doing something that you shouldn't be doing, one of my favorite movies is with Jack Nicholson, and he goes to the hospital and he's having a cardiac problem, and the doctor's getting ready to give a drug. And he's got the needle about this far from his arm. He says, have you taken any ED drugs? And Nicholson, no. He says, well, why do you ask? Well, because if I give you this drug and you have, it's going to kill you. So be certain to be honest about what is going on. Provide as complete medical history as you can, which includes the details about information about past illnesses, medications, hospitalizations, and other matters related to the current health. Give you an example. I told you I had surgery. Surgery was in '87. And it was reconstructive surgery. They had to reconstruct my tendons. And so in the last year, I've had an interesting development around my ankle. The tissues have changed, the veins have changed. And so I went to my doctor, and the first thing he said, well, you may have an edema, but then he looked at my other leg and he said, no, you don't have that. What's going on with this leg? What happened to this leg before? And he was able to diagnose post-surgical trauma. So it's important that we articulate what's going on. Cooperate with agreed upon treatment plans. If you have a treatment plan and you do not follow it for whatever reason, whose fault is it? Yeah, it is. But time and time again, people do not follow it, and the first thing they say is, well, my doctor's a schlep. You know, he told me to do something that doesn't make any sense. Coordinate routine medical care and delivery of needed medications. If you accept an assignment or at a post where medications may not be available, stay on the regimen. It is easier to do that than catch up. And the drugs often lose their efficacy when you put yourself in a position of having to catch up. Pain medication is a perfect example. If your pain level is somewhere between 7 and 10, and you decide not to take your pain medication, you get what you asked for. Fulfill the financial responsibilities that are incurred when seeking medical care of the local economy. I will tell you that is almost a nightmare today in today's medical world, trying to figure out what things cost. There is a dynamic between Medicare and Medicaid and the insurance companies that really has to be worked upon, and you have to stay on it. But they have the obligation to be honest and forthright with you and tell you what's going on. There is a website in which you can file a claim against a hospital should you feel that you have not been treated properly. Okay? So there are rules that protect you, but there are also rules that protect the medical group as well. Click. Isn't that wonderful? Yeah. You speak it and it comes into being, almost like it's out of ex nihilo, out of nothing, right? So communication is important in all areas. You get nowhere just lying there. But as an outpatient, let's take a look at some of the things that are required for communication. Number one, make certain that your physician is a board certified in the relevant medical specialty. If you have cardiac issues, don't go see a renal specialist. Two different areas of the body. Although they can be related, if you have cardiac issues, you want to go see a cardiologist. If the doctor is good but staff is underperforming, you may want to find a new doctor. If you try to get a hold of the doctor's office time and time and time again, and they give you a runaround and you can't get to the doctor, it's time for you to get another doctor. But don't, yes, sir?
The challenges the physicians are having now is practices are being acquired by the hospitals, and they do not control the staff.
The hospitals own the practice. Yeah. Yeah, we had that problem when we were down in Americas 3 weeks ago with Bishop Emanuel. But it's also important that you communicate with the physician what's going on, if it's nothing else but an email or a voicemail. Because it's a practice that they're involved in, and they need to know what's going on. Always try to establish a good rapport with a clinician. I don't know about you, but if somebody's going to stick me with a needle, I want to be on good terms with them. And if somebody's going to stick a finger somewhere where fingers don't belong, I really want to be on good terms with them. It's important that we understand we get a lot more by being kind than we do by being acerbic. Fourth thing is, with permission, consider audio recording. In the last 9 years of being here, there have been a number of times in which I've been with parishioners that the diagnosis was going to be very complicated and very long and require a number of notes, and we've asked, could we record, and they've allowed the recording. But do not record without asking first. Make certain that you ask. But if it's necessary for you to understand your treatment and what you need to do, please do so. The other thing is, we have a tendency to live into a great deal of anxiety in the doctor's office. I have what's known as white coat syndrome. My blood pressure elevates by 10 to 15 points. I can walk out of the doctor's office and it goes down. And so if I don't communicate that to the doctor, I'm going to wind up going somewhere to have them treat me for my blood pressure. So it's important we do those things. Be descriptive and precise as you can with problems, and anticipate follow-up questions. It hurts here. Well, why does it hurt here? Well, you know, I rub it all day long. Don't rub it. But be able to articulate what's going on. For new medications, try to find a projected cost before obtaining the prescription. There's nothing wrong, absolutely nothing wrong, with you saying to the physician, is there an alternative financially to this prescription? Is there a generic? Give me an example. There are many drug trials in regard to things like pancreatic cancer and other forms of cancer that the drugs are astronomically priced. Thousands upon thousands of dollars for one treatment. Many people don't have the capacity to do that, even with Medicare and Medicaid. If you are honest and upfront and straightforward, excuse me, with the doctor, often they can contact the rep, and many companies have programs that you can go on that they will support you in getting the drug to you. They're just as interested in you being healed as you are. So you need to be honest about the financial implications of medications. Does that make sense? Or treatment. If you work daily, start the new drug regimen, then this is a question that you have to ask. Can I start the regimen on the weekend? If I'm to take the medication 3 times a day, can I start it on the weekend? That way I can build up an expectation that every 4 hours I'm going to take that medication. And I can take that with me to the workplace. 8, if you have a complex medical issue, consider getting a second opinion. I would urge you to do that. There's nothing wrong. You're not going to insult anybody. You're not going to hurt anybody's feelings if you go get a second opinion. 90% of the time, it's probably going to be the same. But it's for your peace of mind. You want to know that you're getting the best medical care. You want to know that you're on the right track to health. And so communicate in a manner that gives you the best amount of information. Does that make sense? Number 9, when you see multiple specialists, make sure your records are sent to primary physicians. Now, if you are a primary physician, although it's changing dramatically because now the primary physician's offices are owned by the medical systems. Give you an example, Piedmont owns probably 95% of all the doctors in the area. And so they have an opportunity to read the notes. Up until just a couple years ago, that was not the case. Your physician couldn't read the notes. If they're not licensed to go into the hospital, they're not going to have access to the notes, and they're totally incumbent upon you. I was in a situation where a parishioner had brittle diabetes, and she was on a floor, and they were going to give a bolus of of medication, and it was 10 units, it would have killed her. And her physician would have said that. And the mother picked up the phone, dialed the number, handed it to the doctor, and said, here's her physician. Make certain you communicate. Everybody's in line, okay? If it doesn't sound right, have them communicate. And when you see a specialist, make sure your records are sent to the primary physician. Make certain they know what's going on. The other thing is, make certain that there's coordination between medications. I can't tell you the number of times I've been in the hospital where medications have been changed by the hospitalist, and then the individual will go back to the physician, and the physician will change the things back again, and everything gets absolutely crazy again. So make certain you're communicating dosage, medications, what's been prescribed, when it's been prescribed, and make certain everybody's on the same page. Now, how do you communicate? Actually, we're doing pretty well on time. Good. How do you communicate in any questions about normalcy? This is kind of as an outpatient. If you go to see a doctor, these are the kind of things that you want to make certain that you do. But always listen and articulate how you feel. Not that I hurt all over. Okay. How do you hurt all over? Think it through a little bit so that you can, the quality of the communication that you have and you give is going to determine the quality of care that you receive. Okay? It's really important you keep that in mind. Emergency. That's often we don't have control. If you're in a car accident and your life is threatened, you're not going to have a lot of control. And let me tell you, the guys that are on the guys that are in the ambulance are concerned about if you're on any heart medication. They want to know if you have heart issues. They want to know things that would be immediately life-threatening, but their primary role is to triage you, care for you, and get you to the hospital so you can be made well. But it's really important that if you're there or if somebody's with you, if someone comes to your house and they pick you up at the house, that whoever's there be able to articulate the extenuating circumstances that you have medically. He's on blood thinners. Oh, gosh. Let me tell you, folks, you need to articulate that. Because the treatment of the wound is different with blood thinners than it would be without it. And so that's very important that you articulate that. If you've not done so, make sure you've completed the advance directive and have it on file. By the way, Piedmont will put it on file. We'll keep it on the, yes, sir. Next, can we do that? Come on. I'm going to start calling you Clicker. Used to be my friend Flicka, now I'm going to call you my friend Clicker. So, an emergency situation is complicated by anxiety, time, and the level of crisis. And all three of those things inhibit our ability to think clearly. Last year we had a situation, I was in a house when a person had fallen and the ER, the ambulance came, and the first thing they ask is, are they on heart medication? Do they have heart issues? Do they have breathing issues? And are they on blood thinners? And it just so happened the patient they were picking up was on blood thinners. And so it was very, very helpful to know that information. Have your advance directives done. The guys that pick you up in the ambulance have an obligation to keep you alive. It's important for you to know that. If they pick you up, they have an obligation to keep you alive. That's why if you are in hospice, you do not call 911. That will get you revoked out of hospice. Hospice is a different type of care. We'll talk about that next week. If you are picked up. Be patient unless it's truly an emergency. If you go to an ER, expect to burn a half a day there. And it's frustrating. Take earbuds and your iPhone and listen to music. Do whatever you have to do, but understand they're doing the very best they can. I'm in and out of the ER all the time, and I have not been in an ER in any hospital in the area. And I go to Emory, Grady, all of the Piedmonts. I go to LaGrange. I go to Griffin. I have yet to be in an ER and see a group of them sitting around playing cards, asking when the next patient will come in. They are busier than one-armed paper hangers. And do not say to them, "Have you been busy today?" That's not a good thing to say in the ER.
You have to understand there's a back door to the ER, and that's where all the other ones are coming in.
Yeah.
Well, it doesn't look busy in here. I don't understand.
The medical system we have now, because hospitals are obligated to treat people. If they walk in the door, they are obligated to treat you. That's why our Medicare expenses Medicaid expenses are so high. They're obligated to treat. And what happened is, under Obamacare, the ERs have become the primary physicians for many people in this country. And so be patient. Remember that your primary objective, if you go to the ER, is to get treatment, to be cared for, to be helped, okay? Understand that the emergency physician's main job is to triage, treat, and release versus admission versus transfer. The primary thing they want to do is they want to find out what's wrong with you, how they might treat it, who might treat it, do they need to transfer you? And by the way, we are in a land of hospitals that are amazing. Piedmont will transfer you to Emory or Grady if it's a trauma situation in the drop of a hat. Yes, sir.
Somebody who's recently had to go to ERs, our EMT guys here, and ladies, are extraordinary. And so I have always, my trips to the ER in the ambulance, have gotten their names. I write the mayor.
Thank you.
I get a call from the mayor thanking me for telling her how well I was treated by the EMT folks.
But-
So it goes, if you can think of it, get their names, drop the mayor a line, she will contact their bosses and tell them how much that they were appreciated.
My life was changed forever in 2001 when I served in a trauma unit and dealt with the EMTs. And Fred suggests that you get the names and you thank them for their care because it's amazing. I want you to think about something just for a second. You get up in the morning and you go to work, and you know that every time you go out on a call, the person may die in your hands. Or you may be the sole factor that is the difference between them dying before they get help and getting help. That's a pretty sobering thought. And if you ever had an opportunity to work in an ER and you see the guys coming in, some of them make many runs a day. And every run is an anxiety-filled effort. And so Fred's point of thanking them and getting the names and being thankful is really, really important. Next one, please, clicker. As an inpatient, be patient, but assertive. Don't be a doormat. Welcome to the bureaucracy, which is the hospital network in our country. It's still the best medical network in the world. Everybody in the world comes here for treatment. There's a reason. It may be frustrating for us, but it's still the best care. The hospitals are now manned by hospitalists. They are doctors that are contracted by the hospitals on regular floors. And you may be on a floor, they may have 3 or 4 hospitalists during the week. You may see 3 or 4 different people if you're there. And so it's really important that you communicate. You ask the same questions. You make certain there's continuity in what's being examined. You're not going to see a doctor in a hospital but once a day unless it's an emergency situation. Medicare and Medicaid will not underwrite a doctor's visit in a hospital but once a day unless it's an emergency situation. So it's important that you understand that. Don't get frustrated. Your most frequent interactions will be with nurses. And we have an incredible community of nurses in this area. Grady, as crazy as Grady can be, trust me. Grady, I had an opportunity to go to Grady in December on a Saturday night at 11 o'clock, and I passed 4 major gun wounds going to the person I was going to see. But those people were there. They were on top of it. They were engaged. They cared about every person regardless of the situation. And so know that the person that you're going to probably interact more often than not is a nurse. Let me tell you something I think will really endear you as you introduce yourself and ask if you can pray for them. Ask if I can pray for your day. If there's something that's going on in your life that you have to deal with as you walk from person to person, and can I pray for you? Make a connection that's on a spiritual level, just not on a care level. If something is confusing, doesn't make sense, speak up. If you're left in the dark, it's your fault. Honestly. If you didn't see a hospitalist, if you were asleep on the rounds, tell the charge nurse, or tell your nurse, I want to see the hospitalist. Or my caregiver, my health care agent wants to see the hospitalist, and so forth. But make certain that you are seeing. Next, and so let's go to interventions. Interventions is when it's a serious injury or a serious disease in which it requires a surgical application or surgical practice. They're serious. They're usually significantly invasive, and no matter how routine they are, I don't care how routine they are. They could be as simple as taking out your appendix, but they can lead to your death. Anytime you open the body to a number of different things. And so understand that it is serious and make certain you communicate. Communicate and advance your wishes by advance directives. There are 4 parts. Part 1, you need to have a healthcare agent, someone who's going to be able to make decisions for you. And it's in the handout, and we're going to go over that again next week. Part 2 is the treatment preferences. If I code, what happens if I code? And we're going to talk about that in just a second. You need to know what the codes are. Part 3 is guardianship. If I am left incapacitated, who is going to be my guardian? If I can no longer function physically, legally, who's going to be my guardian? And part 4, the effectiveness and signatures. If you could get the next. Communication is important in all areas, and particularly in end-of-life discussions. I so feel for physicians. This is the part of the conversation that freaks my son-in-law out. He can't believe that I have these conversations. But there are times where you have to have conversations that ask the question, is this viable? Is this life viable? If we took all of this away, would the life be viable? And if that person does not want those treatments, then they need to be removed. And that's why the advanced directives. I had somebody tell me this year their mother was kept in a hospital for 18 months on a ventilator, fed by a tube, and she was not alive. Had not recognized them in 24 months. That was not what she wanted, but she didn't have an advance directive. And as long as you are breathing and as long as there is brain activity, the hospital has an obligation to treat you. And trust me, you want it to be that way. That's why advanced directives are so important. End-of-life discussions are very difficult for physicians. I feel for them. They take an oath when they're sworn in and they get their medical license to do no harm. And so everything is about saving a life, which kind of leads to I am God syndrome, but that's another thing, another discussion for another day. But it's very difficult. Be kind to them. Make certain you ask questions on a repetitive basis in a different manner that gives them the opportunity to be human. I pray with them before we have to make those decisions. End-of-life discussions are mandated by your insurance company, and it's mandated by Medicaid. If you have a hospice discussion, that has to be mandated. And that's an end-of-life discussion that says the treatment that we have is not going to be effective, but we can care for this person and keep them comfortable. End-of-life discussions should start in the outpatient setting. You should have this conversation with your general physician. Your general physician should know, should something happen to me, I do not want to be kept alive. Have you ever thought about that? And it's really important that you do. So it's really important that you know the code status. What status do you have? Clicker. The full code status. Full code status means that they will do everything possible to keep you alive. My first week in the hospital, I was on the crash team, my second day. And if you've never been on a crash team, that's really quite an experience. I was 2 halls away. I had 3 minutes to get to the crash site once the announcement was made. I walk in the room, and there's a 62-year-old man, absolutely buck naked because they have cut everything off of him. There are 2 people straddling him. There are doctors and nurses all through the room. Things are going crazy. Any sense of decorum was out the window. It was all about saving the life. They will do everything they can to save the life. By the way, when you do chest compressions, you more often than not, break ribs and can do some significant damage. There's the ACLS, which is Advanced Cardiovascular Life Support. They will actually put you on life support to maintain the heartbeat, connect to monitor and defibrillator to determine rhythm, shockable or non-shockable, epinephrine, and post-resuscitation care. All those things will be done. There's no questions asked. Their whole purpose is to keep you alive. If you've ever been in the hospital and they say, Code Blue, room 362, East Wing, somebody has just coded. I cringe when I hear it. There are times that I've wanted to get up and run because I did it. The next code, if you will go to the next slide, please, is called DNR. DNAR is the proper term, but we just kind of slang DNR. DNR says that you are to withhold the measures used to restore or support cardiac pulmonary if you have a cardiac arrest. If you're DNR, they will not resuscitate your heart. However, if your heartbeat returns and is minimal, they will keep you on respiratory care and keep you alive by way of breathing. So you have full code, which says do everything you possibly can to keep me alive. That's the default, folks. The second is DNR. That means if it's a cardiac issue. Clicker. The next is DNAR, DNI, which says I don't want to be kept alive, period. I want to withhold the measures used to attempt to restore and support cardiac and pulmonary function in the event of a cardiac or respiratory arrest. In other words, I don't want to be brought back. Also forego intubation in circumstances other than respiratory or cardiac arrest. You have that capacity to put that on your advance directives. Intubation, they put a tube down your throat. It can be a relatively difficult thing. You have these choices, but you have to be able to communicate them by way of your advance directives. Next clicker. Now, what about if I make these decisions, can I change my mind? If you make any one of the last two designations and you are conscious and deemed by the doctor to be mentally alert and capable of making a decision, you can change your code. But that's not the case, no. Your healthcare agent can do it per your advance directive. Your healthcare agent can bring the advance directive and say they do not want to go full code. This is what has to happen. Your spouse can do it. Again, if it's in advance directives, your spouse cannot change it. Your sibling cannot change it. Your children cannot change it. The advance directive is a legal document that says this is the care I want and I want no one to mess with it. We had a situation in the last year in a hospital where we had to go to the doctor and say, do you have a copy of the advance directive? Yes, I do. What does it say? They read it back. Do it. This isn't up for debate. The patient was clear when they were conscious what they wanted. They were clear in articulating it in the advance directive. So be certain that you understand the hierarchy of the decision. You are the primary maker of that decision. Don't put it in somebody else's hands. Make the decision. It's a terrible place to be. It's a terrible place to be. I've been with many, many families where they would want to know what mom would want or dad. And you got 5 siblings standing around, and 2 of them said, well, I want to keep mom around. She can get better. She has no heart function. She has no brain activity. They're keeping her alive simply by ventilation. No, she doesn't want to be around. And so you can avoid a lot of issues for your children and for your relatives if you make the decision. Don't push the peanut across the room, please, okay? Without one of the authorized decision makers, code status cannot be changed to DNR or DNI, DNR. You can't change it. It has to be done in advance. So please do it. Clicker. So in conclusion, on code status, make certain that you discuss your desires around code status with your family. Make certain there's no ambiguity with your children what you want. Make certain there's no ambiguity with your spouse what you want. I've seen families get into unbelievable fights. Mothers against their children. Spouses against their spouse. It's amazing how spouses who are married in the family suddenly have as much weight as the person who was born into that family. So I am reminded of the Shema. Love your neighbor as yourself. Love those you will leave behind as you want to be left, and give them grace and make the decisions for them. Make your physicians known to your primary care physician. Your primary care physician should know exactly what your wishes are. It'll be noted in your chart. And include your wishes in your living will and make updates as necessary, as often as necessary. You should review, at least on an annual basis, all of your advance directives. Have your health issues changed? Give you an example. If you're relatively healthy, you may feel pretty good. And you want them to resuscitate you at all manners. but now you have you've found that you have something that is ultimately going to be terminus. Why would you want to be resuscitated? Do you see what I'm saying? So, by all means, do this and be proactive. Next week, we're going to talk about the world of hospice, and we're going to talk about the legal world. So, click. Ta-da! Any questions? I know this is a sobering conversation, but trust me, the difference between families that are prepared and the families that are not prepared are light and day. Okay? Let's end with prayer, and for Bob Brasher's purposes, I'll give you the prayer number. It's really not a number on it, but it's out of the burial office. And so, the Lord be with you. With your spirit. Let us pray. O God, whose days are without end, and whose mercies cannot be numbered, make us, we pray, deeply aware of the shortness and uncertainty of human life. And let your Holy Spirit lead us in holiness and righteousness all our days, that when we shall have served you in our generation, we may be gathered to our ancestors, having the testimony of a good conscience, in the communion of the Catholic Church, in the confidence of a certain faith, in the comfort of a reasonable, religious, and holy hope, in favor with you, our God, and in perfect charity with the world. All this we ask through Jesus Christ our Lord. Amen. Thank you very much. Yes, sir.